instructors and mentors who will guide you through the changes and who will help you shift from, look, that medicine is not, the science of medicine is not different anywhere around the world, but the practice of medicine is different. And so that's what we need to do. We need to just shift that focus that you guys have learnt in this great institution and shift it towards a UK perspective. PLAB 2 is an OSCE style exam. So PLAB 1, you can sit in multiple locations around the world, so you don't have to leave wherever you are. PLAB 2, you will have to visit the UK. It's because it's an in-person exam, it's an OSCE exam, and you will need to visit the great city of Manchester. Does anyone fancy visiting Manchester? Everyone? Fantastic. The next slide, please. Okay, so PLAB 1. PLAB 1 is 180 single best answer questions. You guys know what single best answer is? Yeah, so short scenario or short clinical picture, and then 5 options, usually 5 options, pick the most correct or the only correct one. And it's 3 hours, so you have 1 minute per question. Now the good thing about PLAB 1 is it can be sat in multiple locations around the world. I don't believe Kyrgyzstan is on the list, unfortunately, but there are multiple locations in both India and Pakistan, so it can be done in them 2 countries. Next slide, please. So PLAB 2 is OSCE stations, 18 scenarios, each lasting 8 minutes, and it's 3 hours and 10 minutes, and you have to come and visit the centre in the UK. But what we will do is, it can be done in multiple ways. PLAB 2 courses can be delivered here in Jalal-Abad, or in India, or in Pakistan, anywhere in the world. We can come to deliver the courses here, but then for the actual test, you have to come to the UK, and then if you visit Manchester, you complete the examination, and then we will grab a hold of you and we will not let you go back until we've secured your job in the NHS in the UK. Next slide, please. So just very quickly, I know you guys are students. I remember when I was a student 20 odd years ago, we were very keen on what's the passing rate, how difficult is it, etc., etc. Well, we did a seminar yesterday in Osh, and lots of students were asking, you know, what's the pass rate, etc. So it's a competitive exam. So that means there is no set pass rate each year. What that means is it depends on how capable the year group is. If the year group is better, the pass mark will increase a little bit. If it's slightly less capable, it will come down. So these are just an illustration of the figures for the last 5 years. PLAB 1 pass rate can be as low as 63.1%, and PLAB 2, the last 5 years, has been low as 62.9%. Now the point of this slide is just to give you an illustration that there are unfortunately a lot of people who fail the PLAB exams. That's because they try to complete the journey on their own. They try to complete it without the proper coaching, the proper guidance and instruction, but we won't let that happen to you guys. Next slide, please. Again, just an illustration, rather than percentage, just numbers. So remember guys, this is 2023. In COVID, 2020, 2021, the numbers plummeted massively because obviously people couldn't come to the UK. The numbers are climbing back up again. So in 2023, 21,916 doctors attempted PLAB. That's a lot of people who are keen to move to the UK. Only 15,781 passed. So around about 5,000 or 6,000 didn't pass. PLAB 2, 15,702 doctors came to the UK, attempted PLAB, and less than 10,000 of them passed. So it's a you guys can all pass the PLAB exams. As I mentioned at the beginning, it's a foundation year level exam. So when you are in your 5th year or your 4th year, your knowledge is fresh, you're revising for finals, it's the best time for you guys. If you're interested in moving to the UK, and why shouldn't you be interested in moving to the UK? Fantastic experience for you. Start thinking about your journey to the UK now. Start preparing for it now because you're revising anyway as it is. It's not difficult to pass the IELTS. All of you guys, Indian, Pakistani students, you're all from former British Empire countries. You all speak English. All you need is just a little bit of coaching to clear the exam. And then PLAB 1 and PLAB 2 is not too different to the level you are doing at undergraduate level. It's only just slightly above the undergraduate level. So it's quite easy for you guys now. If you leave it, you'll think, oh, I'll do it in 2 years, 3 years, 4 years. You will get out of touch with that fresh knowledge that you have, and it will be more difficult for you. Next slide, please. Okay, so we've already spoken about eligibility criteria. It's very, very simple. You need a medical degree from JASU. That's it. You're eligible. Okay. Booking the seat for the exam, preparation, what is lacking, additional support required. You don't need to worry about any of that. You get your degree from JASU and then leave the rest to us. We'll prepare you, we'll train you, we'll book your seat, we'll book your accommodation, we'll book your flight if you want. We'll do everything for you and take you over, help you through the exams. And like I said, once we've grabbed your hand, जब हमने पकड़ लिया ना हाथ एक दफा तो फिर हम छोड़ेंगे नहीं. You all understand that, right? So all you have to do, guys, you just have to offer your hand. Once you've grabbed it, we're gonna take you with us, and we're gonna go and land you in Manchester in the UK, or in London, or whatever city you want to go to. Okay, next slide, please. So again, administrative side of things, preparation and practice, other support required. You'll see if you try to do this journey alone, you will have to look at the UK guidelines, you will have to look at the British National Formulary, you will have to look at the MHRA guidance on safety of drugs and all these things. If you give us your hand, you won't need to do any of that. Our curriculum is updated every few months with all the latest guidelines. You just need to register with us and just do our course and you will pass your PLAB. Next slide. Okay, I'm not going to spend long on this, but very briefly, you might have heard of the UK MLA. UK MLA is the medical licensing exam for UK graduates. So currently in the UK, if you complete a medical degree at a UK medical school, you don't need to pass a licensing exam to practice in the UK. You just need your medical degree and then you practice. But this year, 2024, they are introducing the UK MLA. So in that sense, India and Pakistan are ahead of the UK, right? Because you have the NRE and you have the equivalent in India. So remember, guys, that never be ashamed of where you come from. Never be ashamed of your home countries, and bring that. They're both great countries. Bring that pride with you and bring it to the UK. It's a very welcoming place, and you will enrich the experience there for everyone. So UK MLA in 2024, the PLAB is just going to be matched with UK MLA. There's going to be no significant change. So you might hear people saying, oh, you know, before we used to do PLAB, now it's UK MLA, it's going to be harder, or it's going to be easier, or it's going to be X, Y, Z. Forget all that nonsense out there. Don't listen to anybody who's not involved in teaching and helping people pass these exams. The UK MLA and the PLAB requirements are just going to be made the same. That is all. Even the name of PLAB might not change. We still don't know. We're waiting for the GMC to tell us. But don't worry. will guide you through all of that. Next slide, please. Yeah, we can skip this one. Next slide. So, there may be a name change. PLAB 1 might now be called the AKT or Applied Knowledge Test. PLAB 2 might be called CPSA. But the requirements are going to be the same. They're not going to change the clinical competence level required for you to work in the UK. Next slide, please. We can skip this one also. There might be some of you who complete the journey with the exams when it's called PLAB. No change for you. There might be some of you who complete the journey if the name is changed to UKMLA or UKMLA International or whatever, no problem. There might be some of you who start when it's PLAB 1 and you finish when it's UKMLA. The exams will be the same, so you don't need to worry, you won't get stuck, you won't get lost in the system. It will just be the same experience for all of you. So don't worry too much about UKMLA. Next slide. Okay, so just to remind you guys, why are we here? Myself, Dr. Shakir, Dr. Parvaz, we were like you guys 20 years ago, 30 years ago. We were just about to finish our medical school. I was in the UK, but Dr. Shakir, Dr. Parvaz, they were in Pakistan, and many of our esteemed faculty members were in their own countries as well. But there is an opportunity for you guys to do something exciting, to explore the world, one of the great countries of the world. And then if you want to go back to your home countries, you can take that experience with you. But why are we here today? We're here because we want to take all of you guys, every single one of you, to work in the NHS and to come with us, visit us in Manchester, stay with us, and let us help you to get there. Next slide, please. And again, please. Okay, so I've already mentioned how great the NHS is. Just a quick summary there of some of the benefits. Great amounts of paid leave, lots of housing and car rental options, lots of flexible working practices, NHS discounts, etc., etc. That's all brilliant. The NHS pension scheme is one of the biggest in the world. And I know, look, at the end of the day, it's a career, it's a passion, but it's to support yourselves and to support your families. You guys can go from, if you start F1, you will be earning £3,000 a month. That's on day one. As soon as you start F1, and you complete F1, you can go to locuming in FY2. You can start on 25 to 30, even £50 an hour as a locum per hour, British pounds sterling. And then once you have gone a bit further in your career, you will be on £100 an hour, and then you will be earning £250 an hour as either a consultant or a GP in the NHS. So it's a great opportunity for you guys, and it's really one that should not pass up, and you should start to think about and start to inquire about now. Next slide, please. Okay, I've done enough talking now, so I need your attention. I know you're getting a bit distracted. We're just going to go through a few MCQ, single best answer questions for the PLAB 1. So, guys, I was in front of a lecture hall yesterday. We had about 200-300 students. They'd been sat in lectures since 10 a.m. in the morning. I spoke at 7 p.m. and tired, etc. But there was so much energy in the room. So, guys, we need your interaction here. Please, we're here to guide you through this. Need your attention. So please join in and let's have a bit of fun with the questions. So please go ahead and read, and then we'll go through the options. Okay, A, how many for A? How many for B? Any for C? One for C. D, couple for D, and E. So everybody else would not put an answer down. Who says A? Come on guys, don't be shy. A, B, C, D, E. Okay. There's still lots of people who didn't volunteer their answer, but no problem. Let's move to the answer slide. Next slide, please. Answer is D. Well done. All right, guys. Do you guys use HbA1c in Kyrgyzstan?
No, sir.
Do you use HbA1c here?
No, sir. In Pakistan, sir.
Exactly. Okay, so the point of this question, showing you this question is that this is a past question from one of the papers, okay? Is that you guys use different units, different measurement, different diagnostic criteria, okay? There were some options on that question which look like they could be right, but you've never come across HbA1c of millimoles per mole, or you might have heard of it, but you're not sure what the actual diagnostic criteria is. You're not sure what it is in percentage, but you know fasting blood sugar, you know random blood sugar, you know oral glucose tolerance test. So this is to illustrate that you need to know the UK guidelines to pass the test. You need to know about HbA1c. You need to know about diagnosis of HbA1c is millimoles 48 and above. Okay? All the other things apply. So fasting blood glucose still applies. Oral glucose tolerance test still applies. But the diagnostic criteria were not met in them other options. Okay, next question, please. Okay, let's have a bit more interaction with this one. So, 60-year-old woman. Okay, very quick reader. Wow. C. Okay, great. Who says A? B. C. This woman and a few others. D. Okay, and E. Okay. Still, lots of you didn't answer the question, no problem. Please, what's your name? Anna. Why did you pick C? It's okay, don't.
Good evening, everyone. My answer is C, the ventricular septal defect, because so C. My answer is C, the ventricular septal defect, because when I read the question, sir, it's showing like a 60-year-old woman. So very quickly, sir, breath replace all the things. So my mind is just ventricular septal defect.
Thank you, Anna. Anyone else want to speak? Okay. Sorry? Next slide, please. VST. And it was very quick. I had only started to read it and he finished and he got the correct answer, so well done. But again, the point of this question is, can we just go back a slide, please? Just go back. Okay, so just to illustrate for you, you need to look for the key points in the question. So, 3 days after an MI, okay, she feels breathless and there is a pansystolic murmur. Now, some of them options might give you breathlessness. Obviously, they will give you a murmur, but you've got to pick out the key things very, very quickly and decide. Okay, so well done. Next one, please. And next slide. Okay, guys, quickly read this one. A, B, C. Everyone given up on PLAB? D and E. Looks like nobody likes ophthalmology. Okay, no problem. What's your name, gentleman, young man? Usman. So, what was your answer? You're the only one who put your hand up. Central retinal artery occlusion. Okay, thank you. Anybody else got any suggestions?
Vein occlusion.
Sorry, somebody, I heard something.
Central retinal vein occlusion.
Okay, please stand up. Guys, please listen. What's your name?
Hafiz Sanawla, sir. Hafiz Sanawla.
Yes, please tell us why you chose. Please tell us.
Because, sir, it's not visible to me, sir.
No, you can't look for the answer on your phone.
Answer his question.
I'm joking. I'm joking.
High problem. Sir, in hypertension, sir, if it is not severe, sir, the venous pressure goes rise, sir.
Sorry, say again?
Sir, if the venous pressure got rise, sir, it shows and like, sir, I can't explain in English because, sir, सर जब हाइपरटेंशन में है ना सर, ब्लड प्रेशर राइज होता है ना सर, तो ये जो वेनस प्रेशर है सर, ये हमारे साथ उसके जो है ना ऑपोजिट में राइज हो जाता है सर, तो इसी वजह से उसके रप्चर की वजह से सर हमें वो ब्लड वगैरह सर शो होंगे सर। आर्टरीज जो है ना सर वो बैक पर होते हैं सर, वो स्मॉल आर्टरीज होते हैं उन पर इतना प्रेशर नहीं पड़ता सर, क्योंकि वो सर टर्शियरी सप्लाई है ना सर, तो उसमें इतना प्रेशर नहीं आता सर।
ओके, थैंक यू।
वेल ग्रेट।
Okay, thank you, young man. That's very brave. Well done. Okay, so I just want to point out a few things to you. Please pay attention to the question. So, this lady has hypertension. Okay? She has sudden visual loss. Okay? It's a key point. Sudden visual. Yes?
Sudden visual loss cause in central venous occlusion, and also we can see in the question they have multiple hemorrhages and cotton spots in the retina.
Yes. Yes.
So I think that the central vein occlusion might be.
You also think it's central retinal occlusion. Yeah. Okay. Thank you. So, it's sudden visual loss, right? Does diabetic maculopathy generally cause sudden visual loss?
Yes, sir. Chronic.
Is it?
Slowly, not.
Yeah, so it's not sudden, right?
Yes,
It's
sir.
gradual. Okay. Does wet age-related macular degeneration cause sudden visual loss?
No, sir.
No,
Chronic.
it's gradual. Okay, so that's two answers gone out, right? Central retinal vein occlusion, vitreous hemorrhage, can it cause sudden visual loss?
Vitreous hemorrhage. Yes, sir.
It's just a bleed in the vitreous.
No visual loss, sir.
Exactly.
Yes, sir.
It's not total visual loss,
Yes,
right?
sir.
So that's another one. So it's between retinal and artery. Okay, so now you need to know what are the characteristic features of artery and what are the characteristic features of retinal vein occlusion. Okay, so well done to you, young men. I don't know if that's how you did it or how you did it, but you got the right answer. That's what matters. Okay, well done. Thank you. Next question, please. Next one. Okay, so I think this is the second to last one, so we're almost done, don't worry. So please have a read of this. 62-year-old female presents with weight loss, dysphagia and vomiting. Please have a read. The guys, don't be shy. You're almost doctors. Don't be shy. Shout the answers. Put your hands up. Okay, so who thinks A? B? Anybody? C? Okay. D, 1 second, sorry. D and E. Okay, guys. Can you answer one question for me? Answer one question for me. Which place is better, Osh or Jalal-Abad? I'm sorry, I have 1, 2, 3 witnesses here who might have a disagreement with you there. Last night, we had 200-300 students they were listening to lectures from 9 hours, and there was so much energy in the room. So, let me ask you again, what is better, Osh or Jalal-Abad? Jasu or the Osh University? Jasu! Well then, show us guys, come on. Come on, show us. Wait, what is the correct answer? Come on. Okay, somebody saying D, C, somebody saying E. How many for, let's do it properly, we did this last night. How many for A? How many for B? C, D, E. Oh, पता नहीं क्या हो जाता है यार आपको? What's wrong with you guys? Okay, don't worry. It's been a long day. No problem. Can you go to the lady in the floral scarf at the back, please? Don't hide now. Please say your name and explain why you gave the answer C. Listen, guys.
Sir, myself Manu, it's gastric carcinoma because is there ultrasound bilateral mass is there. Bilateral mass is present in the ovaries, Fruchtenberg tumors. They will metastasize to the stomach and cause the carcinoma.
Okay, can we swap places? I think you should come and teach everyone here. No, really well done. That's a difficult question, let me tell you. That is a difficult PLAB question, okay? Look, well done, thank you, very well done. Look at the key points now. Listen, guys, look, this will help you in your medical finals also. So, most of you probably just focused on the ultrasound scan findings, right? You look, oh, there's ovarian tumors, so it must be an ovarian tumor. Is it benign? Is it malignant? So is it, is it D, is it E, or is it A? You're probably thinking along the lines, but the answer is right in the first sentence. There's a 62-year-old woman, she's a smoker, she presents with weight loss, dysphagia, and vomiting. Okay? So, the only condition there which will give you dysphagia, weight loss, vomiting, and will metastasize to the ovaries is a gastric carcinoma with Fruchtenberg tumors. Exactly the right answer. Very well done. Thank you. Okay, next question. I think this is possibly the last one. Okay, so guys, you're from India and Pakistan. Come on, don't disappoint us now. Malaria is like your specialty, right? Okay, please answer this question. Okay, guys. Any volunteers? Come on, guys. It's your chance to get a round of applause and be famous. Okay. Who thinks A? Okay. Who thinks B? C? Okay. Okay. A. D? E? Okay, no problem. Let's have a look at the answer. Yeah, next slide, please. Answer is A. Well done, and well done to yourself. Well done. Yeah, please. Please explain. Please say your name, service town you're from. Speak up, speak up. My name is Devan. Yeah, and please explain why is the correct answer. Sorry.
It's because
Can't hear. Okay, thank you, thank you. Okay, so again on this question, well done, well done. The key point is that there's hemoglobin, urea, and there's, I think, just go back onto the question, please.
Plasmodium falciparum is the most common in Africa only.
Sorry?
Plasmodium falciparum is the most common malaria in Africa.
Yes, thank you. Most common malaria in Africa also. This,
Plasmodium falciparum.
yes, exactly, thank you. And also the hemoglobin urea is quite specific to falciparum in a particular state. So well done everyone, thanks very much. Let's carry on please. And again. Okay, so Dr. Skeel, very briefly, do you want to just, okay, I'll do it. Okay, so guys, we've spoken about why you should come to the UK, how you can get to the UK. It's extremely easy, it's not difficult. Just very, very quickly, we offer, let's just say it in this way, we offer whatever package you need, whatever help you need. We have basic, standard. If you only need a little bit of guidance, if you feel you need us to help you all the way and beyond, even beyond your job or beyond applying for a job, we can help you with everything. We have resources with audio, visual, mock exams, question banks, flashcards. There's lots of different packages, whatever you guys need. I've learned last night that nobody uses books anymore. Am I right? Does anybody use books?
Yes, sir. Yes, sir.
Well done. A round of applause for this gentleman, please. Thank you. These days, most people don't use books. They do stuff online. They do digital. So let's have a chat afterwards and have a cup of tea. Yeah? Okay, next slide, please. Yeah, so again, just an illustration. You need help with lots of things during the PLAB, after the PLAB, CV writing, interview preparation for jobs. There's a huge list. I don't want to bore you guys too much, but we'll have a few questions. And if anybody's got any questions about PLAB, moving to the UK, or anything else that we can help you with, then we're here for you. Thank you.
What an interactive session it was. Have you guys enjoyed it? Are you guys ready to fly to UK? Yes, I can see the smiles on your face and I can guarantee you most of you are already thinking that you guys are on plane. So if you have any kind of query or any kind of question you would like to ask regarding the whole thing, then you can ask it now. Anyone? So you all are clear? Okay, tell me how you can get admission in HIVE. You guys are clear, right? Yes, that person is right. We can get admission in HIVE by consulting the HIVE Medical Academy, registering ourselves. So any other question? So I hope all of you are clear. Okay. If nobody wants to ask question in auditorium, they can personally approach the HIVE Medical Academy. So they will give you answers personally as well. So now I would like to call upon stage Kari and Nath Kwan, motivational speaker, the stage performer, the TV presenter, live talk show awareness on health, and retired ENT surgeon, the ambassador of HIVE. Yes, I'm talking about Dr. Parvaz. Give him a huge round of applause, everyone. He has 3 nationalities. faculties. Let's hear him out.
Thank you very much. Assalamu alaikum. Good afternoon. Namastakar और सत श्री अकाल जी। As a bridge between Pakistan, India and United Kingdom, in 1988, when I got married from Islamabad to Delhi, you are listening a person who has relationship with these three countries. If I go back about 55 years ago, when I was a boy, I had a dream to join this noble profession to whom you belong. And about 40 years ago, at the level of matriculation and GCSE, there was an incident which actually drives the force behind my passion to become a medical professional. When I'm talking to you, I feel perhaps I'm sitting as a student in your rows and seats. I want to convey a message. You are not only the students, you are the medical professionals, and the medical profession, which is the noble, most profession in the world, lucky enough. But here we are today from the platform of HIVE Medical Academy. Why I am here? To represent HIVE Medical Academy. Why it is different? There are too many academies in the world. Why HIVE Medical Academy is then different? First of all, there is an experience of these three countries which I have just mentioned. And secondly, the difficulties, the tough stages of my life, like the CEO of HIVE Medical Academy, Dr. Shakil Istikhar Malik, when we were at your stage, there was no such technology, no internet, no mobile phones, no such facilities. You are all lucky enough now. We just want to, how we can help you. Don't stay over there. You have traveled from your countries like Pakistan, India, and now you are here in a great university, a great place of study, Jalal-Abad State Medical University. It's a great university. It's due to JASO I started reading and exploring about this due to messages of Professor Dr. Bashir Javed Paracha Sahib. Thank you everybody, especially all of the senior staff and the facilitating force behind Professor Dr. Javed Bashir Paracha Sahib. We are highly grateful. Despite you are very tired, you are very cooperative. God bless you. Best of luck. Best of future. Have a nice day.
Thank you so much, sir. Now I would like to request Dr. Shakil Malik and Dr. Bashir Paraja to please come on stage and say some few words. Give them a huge round of applause, everyone.
Good evening, Jalal-Abad. Thank you so much for listening to us. I'm a big fan of Bollywood, like everybody else. तो मैं सिर्फ ये कहूँगा, जैसे शाहरुख खान कहता है मूवी में ना मैं हूँ ना, तो मैं ये कहूँगा हाइव है ना आप सबके लिए. So anybody who wants to make a career in the UK for better training, better life, better future, hive है ना. Just remember this. So we'll be there. We'll hold your hand like Shahrukh Khan holds. So we'll help you, support you, facilitate you. Thank you so much for everything. And we have in our work the respect, the care, the love you have shown. We feel like part of yourself. Because I'm also IMT, International Medical Graduate. 20 years ago, I was there in your place. I took a break to see and I'm here. I remember my first day when I got my job. My first locum was 25 pounds per hour. I was over the moon. But then time came with the hard work. I remember the day I was working 250 pounds per hour. So if I could do it, you all could do it. So we are here for you. Just give us a shout. We are always, wherever you are, anywhere in the world. If you want to come to the UK, just drop us a call, give us a shout. We will help you. From this platform, I want to convey this message. Anywhere in the world, any doctor who wants to come to UK, hi Hannah. Just remember this one. We'll help you. Thank you.
Thank you, sir.
Hello everyone. So with immense excitement, I would like to thank you on behalf of Jalal-Abad State University, on behalf of our company WCIC. Thank you very much for your time coming to Jalal-Abad and giving me great information how to get job opportunities in UK. Thank you very much, sir. It was our pleasure. And I would like to tell you one thing, that JASU is one of the best universities in Kyrgyzstan. We are as a family and we will... I would like to thank especially Dr. Omar that you have given the best information, very good for our students. They can just make their mind, and after just in few months they are going to graduate. They will get the degree of MD, which is equivalent to MBBS in India or in Pakistan, and we are definitely right to go to UK and get job opportunities. Our company WCIC is a company which are not only supporting the students here in Jalal-Abad, but we support our students in India and in Pakistan also. I would like to tell our students that we have today signed a memorandum with Jalal-Abad State University in which WCIC and HIVE England, UK are going to establish an app which will be called WCIC HIV app for the students, how to have a career opportunities in UK. Please give a round of applause. Once again, sir, I'm thankful to you for your time, and we hope that we know. Thank you very much, students. It was great to have you here. Thank you very much.
And just remember, hi Hannah. You want to come to UK, you want anything, let's give us a shout. Anybody wants to ask any questions? हम लोग स्टूडेंट होते थे बेस स्मार्ट क्वेश्चन करते थे, किसी को इतना कम करके रखते थे, आपने डॉक्टर उन्होंने तो कम ही नहीं किया, मजा ही नहीं आया. Anyway, thank you so much. Thank you.
Thank you so much, sir, for accompanying us on stage.
Please, just have a seat for a second, please, just a second. I would like to request Dr. Shakil Malik to please award a Aqidat has done a lot for your company. I would like to say, please give shield dena yaran ki, लेके